Postoperative nasal bleeding is a familiar risk for ENT and nasal surgery practices. But the key question is not simply whether bleeding can occur. The better question is whether the practice has a consistent, standardized response in place before the patient ever needs it. In this presentation, we will look at post-operative epistaxis risk, why preparedness matters, and how the right product pathway can support a more reliable clinical response. Postoperative bleeding is rarely a completely random event. It often reflects a combination of identifiable factors, including patient history, medication use, surgical complexity, disease burden, and recovery behavior. That predictability creates an opportunity. The goal is not to eliminate every possible bleeding event. That would be unrealistic. The goal is to recognize where risk is higher and make sure the practice has the right protocol, patient instructions, escalation criteria, and epistaxis products ready before they are needed. A bleeding event creates more than just a clinical problem. Even when bleeding is ultimately controlled, it can generate after-hours calls, urgent office visits, emergency department referrals, additional packing, patient anxiety, and staff burden. For the physician, this creates a ripple effect across the practice. The patient may lose confidence in their recovery process. The team may be forced into reactive decision-making. And the practice may experience avoidable operational strain. This is why preparedness matters. A standardized response helps protect both the patient experience and the clinical workflow. The strongest clinical posture is not waiting for bleeding to happen and then reacting in the moment. It is identifying risk early, preparing the pathway, and responding consistently when bleeding occurs. A reactive model leaves too much variation. Staff may respond differently depending on who is available, what product is on hand, or how the patient describes the bleeding. A standardized preparedness model is different. Risk is identified earlier. Post-operative instructions are reinforced. Product pathways are defined, and escalation criteria are clear. This creates a more disciplined approach built around hemostatic control, recurrence prevention, and complication avoidance. Not every postoperative patient carries the same level of bleeding risk. Some patients deserve a higher level of bleeding preparedness before surgery even begins. These may include patients on anticoagulant or antiplatelet therapy, patients with uncontrolled hypertension, known coagulopathy, hereditary hemorrhagic telangiectasia, liver disease, hematologic conditions, or extensive inflammatory sinonasal disease. For these patients, product readiness becomes more important. The question is not only, can we treat bleeding if it occurs? The better question is, do we have the right options available for this patient's specific risk profile? Post-operative bleeding can occur at different points throughout recovery, but the early window deserves special attention. The first 24 hours are when clear discharge instructions, rapid access to appropriate products, and defined escalation criteria matter most. During this window, patients may be leaving the controlled surgical environment and transitioning home. That means the practice's instructions and readiness pathway need to already be in place. This is not the time to assemble a response after an anxious patient calls. This is the time when the response should already be clear. Post-operative nasal bleeding should be understood as a continuum. On one end, there may be expected oozing that can be managed conservatively. Then there may be persistent bleeding, brisk active bleeding, refractory bleeding, or a suspected posterior source that requires escalation. This continuum matters because different levels of severity require different responses. A mild presentation may need reassurance and conservative management. A brisk or refractory bleed may require packing, reassessment, or escalation. The practice should not be making these decisions from scratch in the moment. A defined pathway helps the team respond with more consistency. A standardized response framework helps the clinical team act in the right order. The typical pathway begins with firm compression and appropriate patient positioning. Then topical vasoconstrictors may be used to reduce mucosal vasodilation and slow active bleeding. Next, direct visualization helps identify the bleeding source. If the source is confirmed, cautery may be appropriate. If bleeding continues, packing selection should be matched to the patient's risk profile, bleeding severity, and likely source. And if bleeding remains refractory or a posterior source is suspected, escalation criteria should be activated. The value of this framework is consistency. It reduces variation and helps ensure the right product is used at the right stage of care. Nasal packing is not simply a supply item. It is a clinical decision that can affect patient comfort, mucosal trauma, follow-up burden, and the likelihood of recurrence. A patient on anticoagulant or antiplatelet therapy may require a different product consideration than a lower-risk patient. A patient with elevated mucosal trauma risk may benefit from an option that minimizes disruption during removal. A non-resorbable packing choice requires a clear reassessment and removal plan. And refractory or suspected posterior bleeding requires an escalation pathway, not just another attempt with the same default product. This is why packing strategies should be deliberate and risk-matched. Post-operative instructions are not just discharge paperwork. They are part of the bleeding control plan. Patients need to understand which activities may increase pressure or disrupt the healing field. That often includes avoiding bending, heavy lifting, straining, nose blowing, hot liquids early in recovery, and certain medications unless directed by the physician. Patients should also know how to sneeze safely, how to use saline or moisturizing instructions, and when to call the office. Clear instructions can reduce confusion, lower after-hours call volume, and help patients self-triage more appropriately. Patient education is one of the simplest ways to support a more reliable recovery process. When positioned correctly, epistaxis products are not standalone commodities. They are part of the infrastructure that makes a standardized post-operative response executable. A strong protocol begins with risk stratification. Then it moves to first-line measures, visualization, packing selection, follow-up planning, and escalation criteria. The product pathway supports this process by helping the team respond faster, reduce variability, and match product choice to the clinical scenario. The important point is not that products eliminate bleeding risk. The point is that the right products, in the right pathway, support a more reliable and confident response. Post-operative bleeding risk cannot be eliminated, but preparedness can always be improved. That improvement starts with a deliberate product and protocol plan. Practices can stratify risk before surgery, standardize their first-line response, define escalation criteria, and ensure the right epistaxis products are available when they are needed. For ENT and nasal surgery patients, product readiness is part of responsible post-operative planning. Talk with medicos about epistaxis product options that can support your practice's bleeding response pathway.